Hello everyone, welcome to Bone Doctor. In today's episode, I'm going to discuss about cellulitis. Now first of all, what is cellulitis? Cellulitis is the infection of the subcutaneous tissue of the body. That is, the layer of tissue which lies just beneath the skin. When that area or that part of the body is infected by any germs, such as bacteria, then we call the condition as cellulitis. What are the most common bacteria which causes cellulitis? Those are Staphylococcus and the Streptococcus. Now let us understand, how does cellulitis occur? Whenever a person has a cut in his skin, or he has minor bruise or abrasion in his skin, various bacteria which is present in the environment, in the dust, in the soil, in the air, especially Staphylococcus and Streptococcus, enter the subcutaneous tissue and they start to multiply, causing infection of the subcutaneous tissue, leading to cellulitis. Now, what are the symptoms of cellulitis? The symptoms are localized redness, there will be pain, there will be swelling of that part, and in severe cases, in severe cellulitis, one may notice presence of pus or infected discharge coming out from that area. The most important point to note about cellulitis is that there is no history of any trauma or injury before the cellulitis has occurred. The same symptoms of redness, swelling and pain can occur in the limb or a part of the body after an injury. But cellulitis starts off without any incident, severe type of injury. Who are prone to cellulitis? The persons who have low immune system, whose immune system is weak. For example, the diabetics. If a diabetic person gets a small scratch or a small injury in his leg or hands, bacteria can enter into his body, and as he has a very weak immune system, the immune system cannot take care of the bacteria, and the bacteria starts to multiply under the skin, leading to pus formation, redness, swelling, pain in that area. This is how cellulitis starts. Persons who have chronic kidney disease, persons who are suffering from immunodeficiency syndromes, they suffer from cellulitis very often. Persons who have lymphatic issues, problems in the drainage of the lymphatics, who are suffering from lymphedema, these persons also have a chance of getting cellulitis very fast. Persons who are prone to cuts and bruises, persons who work in the fields where he is exposed to dust and soil and various bacteria, can also get cellulitis very often. Now, how we diagnose cellulitis? Cellulitis is diagnosed by seeing mostly clinically, and we do some blood tests and some x-rays to rule out other types of infection. In blood test, we do hemoglobin, total count, ESR, C-reactive protein to see the amount of infection which has occurred due to cellulitis. If there is pus, we do pus culture and gram staining to know what type of bacteria we're dealing with and what type of antibiotics it is sensitive to. We do x-rays to see whether the cellulitis has spread over to the bones, etc. What is the treatment of cellulitis? Cellulitis is treated with antibiotics. As we know, the cellulitis is mostly caused by Staphylococcus and Streptococcus bacteria. So according to the sensitivity of the bacteria, we give antibiotics to the patient, both orally and local application of various antibiotic ointments to control the cellulitis. We ask the patient to take rest, ask him to keep his limb elevated so that the swelling and the pain subsides very early, and we try to do regular dressing so that any pus which is accumulated is easily drained out. Normally, a cellulitis takes around 10 to 15 days to subside. In complicated case, patients may require antibiotic for 1 and 2 months in patients who are immunocompromised, who have low immune systems. What is the complications of cellulitis? What happens if cellulitis is not cared for? Cellulitis, as we know, is being caused by bacteria which are Staphylococcus and Streptococcus. These are both very virulent bacteria. That is, these bacteria have a very fast capacity to multiply and has a capability to infect various organs very fast. If we don't take care of cellulitis and we don't treat cellulitis early, cellulitis may spread into other organs such as local organs, that is the bone which is nearby, or it may spread to the muscles causing myositis, in the bones causing osteomyelitis, in the joints causing septic arthritis. It may even spread through blood causing infections in the various internal organs of the body. This most commonly occurs in the patients who have very poor immune system. So cellulitis needs to be treated early, because if it is complicated by an osteomyelitis or it is complicated by a muscle infection, then the case becomes very complicated and it becomes very difficult to treat and get rid of this cellulitis. Hope you have enjoyed the video. If you like it, please give a like. If you want to share this information, please do share it. And if you like my channel, please subscribe. So bye bye for now. Take care.